And so, Dr. Monteleone, we saw the news today about Bronny James. And, when sports fans see that news and they see the words cardiac arrest, I think we automatically picture the worst. When you saw that headline scroll across the bottom of the screen or however you got the news, what was the first thing that went through your mind?
Yeah, one, it's such a sad event, and we're all thinking and praying about the James family as they're going through all this. When we think about this from a medical standpoint, there's a lot of uncertainty about what actually happened. So the term that was used was cardiac arrest. That term means that the heart stopped and someone needed resuscitation. That could mean CPR, or that could mean kind of electrical shocks from an AED, an automated external defibrillator, in order to restart the heart. It's certainly a scary thing, and we're praying for him and his family as we go, and hoping to hear the best.
How important are using measures like CPR or an AED in an instance like this? How much of a difference do they make in a positive outcome?
Early availability of those things, so not just using them, but having them there at the moment that this happens, is really one of the most important take-home messages of all of this. Every location where these athletic events are taking place, they really need to be prepared. And having something like an AED present, having individuals who are around that know how to give and provide bystander CPR is absolutely life-saving. It is the 100% difference between someone coming through this and having a great outcome and someone fatally passing away as a result of this happening suddenly. It's really the biggest take-home message, is that education about the facilities where these events are taking place, having AEDs, and then also both for the systems, the teams, the coaches, even the players, and also the families, just being comfortable, being aware of CPR and how to do compression for cardiac arrest.
You mentioned the fact that this took place at a basketball practice. These are young athletes, you think in the best shape of their lives. For me, I think like if you're in good shape, you're healthy and you avoid things like this. Clearly, that's not the case. How do young athletes prevent something like this happening?
That's why it's so scary. When you think about young, healthy people, the most healthy people, right? These are high performing athletes, arguably the highest performing athletes. You don't think about these type of events happening. Usually when something like this happens, and it's rare, but it does tragically happen. It's usually for different reasons than when we think of kind of traditional coronary artery disease. Oftentimes when we think about heart attacks and things, we're thinking about atherosclerosis, long-term kind of chronic problems that come from risk factors. In this setting of it happening to a young individual, a healthy individual, a young athlete, it's usually kind of a different set of circumstances or predisposing conditions that lead to this. Now, again, we don't know exactly what happened in this case or what led to what happened. But when a cardiologist thinks about a young athlete having a cardiac arrest, most commonly we think about certain underlying predisposing conditions. One is something we call hypertrophic cardiomyopathy. It's a change in the heart muscle that's actually most commonly congenital. It's something you're born with. And so it's a thickening of the heart muscle that increases the risk of certain types of arrhythmias, electrical changes in the heart happening that can cause the heart to suddenly stop. The coronary arteries, what carry blood flow to the heart, we think about them traditionally in individuals with certain risk factors for atherosclerosis causing a heart attack, quote unquote, that classic heart attack. Young, extremely healthy individuals, there can be congenital problems in those coronary arteries, things that people are born with that they don't even know about until tragically it can cause something like a cardiac arrest. There's other electrical problems in the heart that can cause primary arrhythmias. People can be born with predispositions to those that can also cause something tragic like this. And so commonly when we think about this happening in the midst of a athletic event to a healthy, active, young individual, we're thinking about those atypical types of scenarios. Like, again, recently in the NFL with Damar Hamlin, it was something else. It was this commotio cordis concept of a sudden trauma causing an electrical arrhythmia. And all these things are rare, but they happen. And they can happen to the healthiest of individuals.
The underlying causes that could happen. I know we're going to have a bunch of parents watching the news tonight, and they're going to hear this story. And in the back of their minds, like you just said, it's going to be the Damar Hamlin thing. And they have to think to themselves, a month from now, my 15-year-old is going to go to preseason football practice. Is there anything they can do now or can look out for now to feel like they're keeping their kids safe?
Absolutely. There's a lot of discussion about this in real time. And as a result of today, there's going to be even more discussion about this. And there's different guidelines that come out from the American Academy of Pediatricians and certain sporting societies and the American Heart Association, American College of Cardiology are all discussing what's the best way to really think about this without putting a bunch of young, healthy teenagers through a million cardiovascular tests that sometimes carry their own risks and problems. There's certain underlying agreements, which everyone knows and everyone agrees to. One of that is just awareness of any history or physical exam findings that might suggest an underlying cardiac problem. So, if a young athlete or a healthy person, if when they're exercising, they're getting certain symptoms, they're getting chest pain or chest pressure or chest tightness, or they're feeling kind of suddenly more short of breath than they usually are and having breathing problems different from their usual activity. It's important for them to be thinking about that, discussing that with their family and with their doctor. If there's a family history of certain conditions, and that can be sudden cardiac arrest, or it could be a family history of things like needing an implantable defibrillator, needing cardiac procedures like that, particularly at a young age, that might speak to certain congenital family conditions that might be carried down into the young athlete. Another one is people having episodes where they're nearly passing out or fainting. And if that's occurring, that might speak to certain types of arrhythmias or problems or sensation of their heart racing or beating irregularly. It's not something that's common, but it's something that a young, healthy teenager might just never think to mention. And so going over all those questions about what's present in the person, but then also what's present in the family is extremely, extremely valuable. Now, there are heated conversations and discussions about what the future might look like for pre-athletic screening, whether some individuals should get electrocardiogram tests done or ultrasound of the heart echocardiogram tests done. And there's not been any real consensus in that on the young athlete. And the events of today and recent months are certainly going to spur a lot more conversation about that. No one wants to put a bunch of young, healthy teenagers through a bunch of unnecessary tests, but at the same time, anything that can be done to prevent something like this from happening is obviously extremely important. Some of the cases, though, some of the things we're discussing, even those pre-procedure tests don't necessarily find those conditions. And that speaks to the first part of our conversation, why the utmost importance is preparation for something like this happening. Because, the availability of that AED, the availability of individuals trained in CPR at the moment, that is an absolute game changer.
And I know I guess I'm just honestly thinking like in the African-American community, I know we have stuff like hypertension, sickle cell, where like the rates are just higher. Cardiac events, cardiac arrest, is that higher in any gender, in any race, in anything like that?
So it's a great question and something that we're kind of learning more and more about. There's certainly presence of certain types of cardiovascular conditions, including chronic cardiovascular conditions, like you mentioned, that are higher in other races. And we think about that very carefully when we're talking about optimization of chronic preventative strategies. We haven't necessarily seen too much of that in some of the predisposing conditions to young teenagers. And we're talking about pretty rare events too. And so, rare events in a small group, but extremely important for us to be thinking about all those kind of specific predispositions to do anything we can, to prevent this from happening to other people.
Got it. Yeah. I think I have plenty, man. Thank you so much for taking some time to educate me. And I'm hoping that we can secure families with a different lens or maybe some questions, just asking the coaches, do you know where an AED is in case something happens at practice? So I'm hoping that we can help some people out.
Absolutely. And, Damar Hamlin and the work that he's done already just in the months since this happened has just brought so much awareness to this. Because you can get trained on how to do CPR in 30 minutes on a weekend, and that might 100% save someone's life. And like we see today, it might save the life of a young, healthy, active teenager, who's at the top of the world from an athletic standpoint. And it's as important in anyone, but that little bit of effort, to take care of your loved ones and bring your loved ones to those training sessions really can change someone's life and someone's family's life.